It's our pleasure to welcome now Dr. Jennifer Bryan, Mississippi State Medical Association Board of Trustees, the immediate past president, but today as the founder and owner of Quiet Signal Technologies. How about that? Dr. Bryan, good to have you in the studio. Thanks for coming in.
Thank you. Always glad to be here. Thanks for having me.
So you and I visited a little bit. You were on with Mary a couple of weeks ago, the Mary Weed Show, discussing this project you've got going on that's kind of adjunct to your full-time job as a physician, and it's some new artificial intelligence-powered technology for the healthcare industry, right?
Yeah, somewhat. Yeah, it's actually there is some AI component, but it is more of a governance platform.
Okay.
So it's a software type layer that integrates with existing clinical AI. Think of it as a safety wraparound about what's in the clinical space.
Yeah.
We know that there are AI-generated errors, and so this is the safety filter of what we are seeing at the bedside that needs to be there to keep patients safe and also to keep physicians and other providers at decreased risk and for liability.
Okay. So what was the catalyst for this idea?
Well, for one thing, really getting into leadership at the American Medical Association there on the Council on Science and Public Health now has opened my eyes to the systemic public health effects as AI kind of goes unleashed around the country in our records, and it's exciting. And you know that, like yourself, I'm overextended and busy with family and professional stuff and advocacy. So I leaned in really early with tech and AI, thinking this is a way that can help me, and it has. So my patients are used to the AI in the exam room helping with progress notes. But very soon I realized there was a lot more AI in my life, like inside of the record itself, suggesting things, coding and is coming up next, and order set suggestions. And so as that happened, I began to see serious illnesses being suggested that the patient absolutely did not have. In some, not my record, but others, they can directly insert those things. And in medicine these days, you are paid for how complex a patient is. So I began to get a little nervous about, I don't want cancer in the chart the patient doesn't have, or these other serious illnesses. Where is this coming from? And it all boils down to, in my perspective, algorithmic things, and then the fact that AI inherently will never be perfect. It's going to make errors just like humans do.
Sure.
And so what's our process for filtering that out at the bedside? Not after the visit's over and I've signed something that's wrong and polluted the record for other people downstream, but how can we make this accurate, and also that patients aren't seeing alarming things at home, because that was happening too, about where did this come from? And so that's all I need.
Okay. So would the tool then, Dr. Bryan, would it integrate with just the off-the-shelf clinical systems that are in use today?
Yeah, so I began to hear and see the need from doctors around the country, and then in my own practice at the bedside. So I filed intellectual property back in April, and we're prosecuting those kind of on a rush track with USPTO about the logic. And it can take various forms, but the simplest one would be it is vendor agnostic. So again, this is a high-level governance platform that would integrate. Okay. And we're excited about it, getting a lot of interest.
Well, the term governance, I've heard mentioned more vis-a-vis software and technology in general in the last couple of months than I think I did in my entire IT career before that. Yeah. And I think that's largely because we are creating all these tools that have the ability to some extent replicate human thought and decision making, and there's always a concern about that. And so this need for framing that technology with some sort of governance and orchestration has become way more important than ever.
Well, like we were talking about off air, I am so pro-tech. Like, it can definitely help us. But how we responsibly integrate it is really important. Yeah. And back in April, when I did file the intellectual property and start the company, at that time, it was more about, this is the next bell. Look what we can do. We can save you time. And we were getting way ahead of ourselves. And I was seeing such risk that I thought, we're not talking about governance. So actually, you know, my other hat is on the AMA delegation from Mississippi. We worked on an AI governance resolution that we got unanimous passage by like over 700 doctors there at the AMA calling for these principles that are laid out in this product. So it's all about transparency. Who said what? Did the AI say it or did the human? And if the AI said it, how confident were they? Where'd they get it from? Reddit or from Mayo Clinic's note last month? So it's understanding where things are coming from and being able to parse out and decrease the rate. And then if the AI doesn't know, it's still going to default to the human and not make stuff up, because that's happening.
That is happening. That's absolutely happening. And the thing that, of course, as you know, the technology is incapable of is fundamental, innate human compassion.
Absolutely.
Can't do that.
No, and I think Jennifer's opinion is that when ChatGPT and OpenAI and Claude and Opus and all of them came out, people began to think, this thing is brilliant. It's so much smarter than me. It's nearly perfect, right? And they were using it, and you began to see the flaws. And medicine and other careers, this is cross-domain, kind of made the same mistake. Like, let's roll with it, right? And it's never going to be perfect. I know Samsung AI Center in Warsaw just put out a paper about mathematically it's impossible to get to perfection with AI, no matter how good the model is. Humans also have a built-in error rate.
Sure.
So it's never been AI or human. It's how we integrate together to get the best services to our patients or whatever our career is in. You know, whether you're doing finance or aerospace or whatever you're doing. You can't. Neither one is infallible. Yeah,
that's totally true. Agree with that. But the good news is, I think that folks that are creating and developing this technology understand that, and they're including guardrails around those tools. But there's a whole new industry of governance and orchestration that's spawning around this.
I think there is limited understanding in some of the categories, but we've got a lot of room to grow in medicine. And I can't speak to other fields. In medicine, we do have some excellent tech companies that are out there from the top thinking, this will work good. The doctor will like this. You know, this is going to be great. And I think that's what makes this approach unique is, you know, as you know, like I'm a physician. That's my day job, but also, you know, a policy author and advocate and all this. I'm an end user of the software. And so inherent things that they really didn't expect, I'm picking up on and thinking, I don't want that risk on me. A good example is a patient I saw today last month that came in after having they fainted, I think. There was no seizure. The computer says this patient has epilepsy. I said, no, they don't. Go away. A month later, they come back in. Does this patient have epilepsy? There's multiple places where you can get tripped up, and if somebody's busy, and in January, there's 25 of those codes because it resets every January, and you've got to figure out, do they really have it? No, they don't. And somebody's 85 years old and not a good historian. So our charts are getting polluted very quickly.
Okay.
And we're getting paid by the government for that. I think that's the important piece is how complex a patient is how we are paid these days, not just how much an office visit costs. So to me, I began to see the numbers, and I think we're talking about in the billions of dollars that are paid for diagnoses patients don't have, and then plans that got hallucinated off of a diagnosis they didn't have. So we got to fix it.
Yeah, what I call over-doctoring.
There you go.
So,
it's over something.
Yeah, and that obviously costs money. There's an economic aspect to that. So somewhat related, but this story caught my attention that released yesterday, and there was a 16-year-old who died of a suicide, and it turns out after doing some research that the ChatGPT, the AI tool, actually advised the child on how to take his life.
Right.
So that's an example of
that. It's a tragedy.
Yeah.
And I'll tell you, too, another reason that I got into this was when I first started using generic AI like that a few years ago, it began to say some things to me that I thought, if a paranoid schizophrenic or somebody with mental illness is listening to this, we're going to have some real mental health crises on our hands. And that is what we're seeing. And so I think the calls for governance are organic. not only in medicine, but that's what that family is saying,
that's right?
So we don't want to overregulate and overstifle because the innovation is amazing. But that's what Quiet Signal Technologies is about.
I got you. Well, if you stay around, we can dig into that a little bit more and find out kind of what your roadmap is going
That sounds
from here.
great.
Yep.
Thanks.
We got Dr. Jennifer Bryan in the Element Well studio. We're stepping aside, coming right back. I was in high school. I put that LP on, and I had a pretty powerful sound system. I'd sleep to that. And
Really?
I'd go to sleep to that. I'd crank up Fog Hat, like real loud. And I was on the other end of the house where my parents couldn't hear it, but it put me to sleep.
I fell asleep to music, but nothing quite that rocking.
Oh, that and the 2-hour roundabout by Yes, right, Rhino? That's like the whole side and then some. But we're in the Element Well studio with Dr. Jennifer Bryan. All right, so this company you've created, Quiet Signal Technologies,
That's right? Mm-hmm.
Where are you in the development, the piloting of the solution, and kind of what's the roadmap from here on out?
Absolutely. Thank you. So we have a legal team based out of Chicago with Hush Blackwell who's helping us prosecute the patents. And so they're kind of handling the intellectual property side and are working with a major academic university on, researching the outcomes and, the money savings and the proof and that it's needed. And also working with a national AI platform right now, have significant inbound interest both from payers as well as health systems that are looking to make things safer. An interesting stat is 88% of health systems in the United States of America do not have appropriate governance systems in place at this time. So got that going on. We do have, the demo and the minimal viable product as well as the code for the overall subject that's been fleshed out and is privacy and compatible, all of those things that it needs to be. I have done an audit on my own panel of patients, about 1,250 or so patients, and really seen the need. And so initially kind of starting a pilot there that I plan to publish on basically how much I was manually having to do versus what can be caught and risk averted and the cost savings. These systems can be complex, the governance, but our projections show that for a system to implement something like this, per doctor or other clinical care provider, you would expect annually $3,000, $4,000 cost to kind of integrate into your existing system, but the return on investment is somewhere around $10,000 to $15,000 annually. So it really pays for itself, and you don't deal with as many clawbacks. You don't deal with the risk of fraudulent things entering your chart. And so there's a lot of benefit here. As you said, governance is heating up. And we think physicians need to be in that space, and that the bedside physician understands the personal risk that's coming at them and to the patient. So we're excited about it. Got a lot of academic and industry interest, honestly, more than I can handle as a full-time family physician. So building out the team now to help with some of that overflow. And actually had some interest from HHS on hearing about it. So it's taken off, and we're real excited about it.
So when you present the solution to physicians, what kind of reaction do you get?
They know. I think they are hoping that somebody somewhere is going to fix it.
Yeah. And
somebody somewhere is giving them the next bell and whistle about, well, we can also do orders for you, and we can also tee up refills for you, and that's great. It's going to have some errors in it too baked in, although hopefully low. But we need to start back at the beginning, which is inherently right now our charts are getting riddled with inaccurate information because, as we said during the break, if a cancer diagnosis slips in, then the ambient, which is the scribe you have in the room that is typing kind of as you have a very natural interaction with your patient, which is what we love. You get back to talking to your patient.
Yep.
The ambient will then make up a plan that did not happen based off of a code that was not diagnosed if it slips in.
Interesting.
And by the time we connect with systems around the country with interoperability, you can see how this scales quickly to be a dangerous problem and an expensive one at that for every other system that pulls in diagnoses the patient doesn't carry.
Okay. Well, that's interesting. So this whole idea of these conversations you have, and then what gets included, and then it's acted upon. I mean, I'm just curious, how do you include a cancer diagnosis when there wasn't one?
Right.
I mean, what happens there?
Right.
Where's the gap?
So inside of all of the major electronic health record systems, there is its own AI. So the patient may see my AI on my phone that I say, this is type my progress notes. And that AI pattern matches and says this patient may have X, Y, and Z.
I see.
Okay.
Based on just conditions, symptoms, and so forth.
And hey, that's great, because if I'm a doc, I do want to get paid for the complexity of the patient.
Sure.
But I don't want all the extra stuff they don't have. And so a lot of times it is very, very wrong, and they are very serious illnesses that are slipping in. And so that is the crux of where I began to see this is a problem. I think that the disclaimers start at the top all the way down that say, hey, we know this is not accurate. Make sure you check it. We cast a pretty wide net because we want to capture the complexity, but make sure your doctors look, or your nurse practitioners, or whoever it is. That takes time. And you turn to the patient, and if you were my patient, I'll say, Gerard, this says you've got metastatic cancer to your bone. I don't remember you having cancer. You would say no, but then you would look at me like, do you not even know me? It erodes trust in me and the record. So it's very messed up, and I don't like the disclaimer. Like, it needs to be safer from the start.
Okay. I got you.
Yeah, not auditing afterwards. We've got audit products that tack on after I've signed a claim that's not right.
Yeah.
So bedside governance, I also say a part of this is credentialed scope. If we thought about an AI can be a ventriloquist puppet. It can be anybody you want it to be, an impersonator, a family doctor, a neurosurgeon, anybody outside of the room.
Sure.
Right? And so I think it's important that it acts as what I have privileges for, what I am credentialed for, and what the dermatologist PA is credentialed for. Because when we start getting all these order suggestions, I don't want them handing me an order for chemotherapy for cancer, right? And so that's where we're getting into is if AI can be everybody and order everything, let's get back to basics. I want a really smart assistant. Make sure I'm not missing anything. Don't give me something I've got to spend 30 minutes tracking down.
That makes sense.
Yeah. It's just basics.
Okay. So it is in fact putting a bit of a governor on the tool, on the technology, hence the word governance.
Yes.
Yeah, and that I shared with you on the break when I was at the AI conference a couple of weeks ago. There were 400 exhibitors, which was just mind-boggling, and I shared with Representative Hank Zuber, who was there with me.
Yeah.
I said, think about this. The vast majority of these companies didn't exist 3 years ago. These are all brand new, like your company.
Right,
It's
brand new.
So, which is great. I mean, we're a whole new industry, lots of new opportunity. And that he had a hard time kind of comprehending that. Those of us in the industry were accustomed to that constant turnover. And I said, look, half of them may not make it, but guess what? There'll be twice as many that'll sprout up between now and that time period.
They will.
It's ultimate capitalism.
We have applied, obviously research support, we're looking there, and then have applied, for funding through some venture capital organizations and stuff. But if there are people that are listening and are interested in it, certainly we are raising funding for this first round. And in development and piloting, as I said, we've got significant interest in that. We have a fledgling website that is growing and being revamped. It's quietsignaltech.com, but it's Quiet Signal Technologies. The product is Shimmer Frame. It's a trademark term on the package, which is clinical AI governance. Okay. And it's about all the principles that Mississippi took to the American Medical Association in June and passed unanimously, and that's what we're all about.
Well, you're probably aware that I've been appointed to serve on the state's AI regulatory task force. Our first meeting's coming up in about a month in September. And so we got our work cut out for us, but you and I were talking on the break, and I think we're in perfect harmony here that we need reasonable guardrails, but we don't want them to be so restrictive and so onerous that it stifles innovation.
Well, and I think it has made my life so much better. I mean, having the AI scribe, I still check every single note and I find errors, and I'm fine with that because it has saved me hours to where I can develop a company.
Sure.
I mean, let's be honest, I didn't have time to do this.
It's
before.
a time-saving tool more than anything
right.
else.
So it's a growth process, and as an end user, I know I don't want a lot of clicks. I want it to be easy for doctors and patients. It should be seamless. It should be integrated. You shouldn't know it's even there. But we do need a safety filter because there's so much waste, right? We know there's waste. I mean, there's waste in all these healthcare expenses. I think this is an easy win for a lot of people. I think regulators will be interested in it. They are already calling for these type things. So we're hoping we can make a go of it.
Okay. Well, are you starting to promote across the country within the industry? Or
yes.
What?
Yeah. We are speaking to a couple of Oklahoma and New Jersey medical associations.
Really
also speaking to the American Medical Association Women Physicians section in October, and coming soon an announcement at a university and at the Steamposium at the Mississippi Children's Museum.
That is awesome. So sounds like you got lots of events scheduled up.
I'm excited about it and grateful
to present this. And most of all, we're going to keep this in Mississippi, right?
That's it.
Okay.
That is it. And thank you for having me.
You bet. Dr. Jennifer Bryan, Quiet Signal Technologies. That's her new tool, governance tool for the healthcare industry. We're coming right back in the Element Wealth studios.